Hey, Dr. Winter. So for this lab, you requested to record ourselves for finding where you would palpate heart rate. So there's multiple different areas throughout the body that you can, but the three main ones are the radial, brachial, and carotid artery locations. So for carotid, you can't really see some mass, but it's like right here on your neck, right next to you, kind of around your sternum, kind of mastoid like muscles. So you just palpate right here, 2 fingers, is very light pressure, and then you should be able to feel it. Because and you don't want to apply too much pressure, because then you can kind of like partially occlude the artery, and that overall won't be that great. And then for brachial, no, let's go radial. Radial is the most kind of main common one, and it is right here, right along the upper part of like the wrist. And once again, just 2 fingers, light pressure, and you should be able to feel it. And make sure when you palpate anything, do not use your thumbs, because then you would get a false reading. And then for brachial, this thing gets like the opposite side of radial. So radial's on this side, brachial's on this side, and probably go I would say an inch or so above your the crease of your elbow, inside right here. Gently apply pressure, and you'll be set. And then and for the sake of because we have to record 2 videos, so for this next part, what I'll be doing is I'll be demonstrating how to properly do a resting blood pressure. And for this, you would ideally have your patient relaxed for 5 minutes beforehand, so their results aren't spiked. You would have them refrain from smoking before doing this, or before doing any serious exercise. And you'd make sure they're in a seated position, with feet on the ground, back supported, and pretty much just have them kind of just relax there. And then you basically, whatever arm you're available to use, whatever arm you could use, you pick that one. So if they've had an issue or IVs in their left arm, your left arm, don't do that one. Use your right arm. But if you can't use your right arm, for some reason, say if a person had a stroke or something of that nature on their right arm, but they have IVs in their left arm, all you have to do is just kind of pause their IV, and then you can do your blood pressure. So what you do, make sure you have the right cuff. So if it's a smaller person, get them a small cuff. If it's a larger person, get them a large or extra large. Make sure it fits properly. Make sure your equipment is fully functioning. And then you put the cuff on your upper arm. Make sure where the line that usually most cuffs have, it says index on it. Make sure that line is lined up with your brachial artery. And you would wrap it on nice and snug. And then you'd have your stethoscope, and then your actual dial, of what it's called, I can never pronounce it. I can't pronounce it, sorry. And then you place the I'm blanking on the name, but you place the I can't pronounce it. Place that right here to listen to it, and then you would pump it up until you hear that first beat, and then pump it up 20 millimeters higher. Then you slowly release when you get to get to that point where you can't really tighten it. You slowly release the dial at a 2 to 3 millimeter pace, and then when you hear that first beat or the first 2 beats, that is your systolic blood pressure. And then you keep on releasing it until you the beats stop, or there's a change in the tones of beat, and that would be your diastolic number. So to kind of demonstrate the position that you would have them in, is you'd be sitting down, kind of relax, sitting back and relax, have them there for 5 minutes, and then you kind of wrap it up and you have them seated, and you get it, and then so you just have them like this. And then in most clinical settings, if you may not necessarily have time to do multiple, but it's ideal if you do at least two um, trials of your blood pressure. So you could have one, um, do it, and then you wait at least a minute, and then do it again. I know from my health career so far, sometimes the doctors order like a standing, sitting, and lying blood pressures, and usually you have to do you do one, wait a minute, do another one, wait a minute, do another one, and then if they want it repeated, you come back later and do it again. So yeah, that is how I made this one video, but that's how you locate heart rate, the radial pulses, brachial pulse, and carotid, and for how you do a resting blood pressure.